A recent report has flagged alarming levels of malnutrition and starvation among children in the Nelson Mandela Bay Metro, that's in the Eastern Cape. So stats from the Eastern Cape Department of Health show that 25 children under 5 have died from severe acute malnutrition in just the last 12 months, while 237 were diagnosed with severe acute malnutrition. Let's take this further with Dr. Eileen Carter from the Human Rights Commission in the Eastern Cape Province. Good to have your time, Dr. Carter. Welcome to the SABC. So why exactly are so many children in the Eastern Cape dying basically of hunger?
So this, unfortunately, good evening, Timkile, and your listeners and viewers. Unfortunately, not a new thing to be happening in the Eastern Cape. The Human Rights Commission issued our report into severe acute malnutrition deaths about 2 years ago, and it seems that the efforts, the promises, and the undertakings that have since been made are not moving the needle enough. And now we are seeing this increase in deaths in the Nelson Mandela Bay area, which is certainly a very alarming a trend that we're picking up on.
And 2 years ago, this was 2023, at the time you flagged that there were about 14 children under the age of 5 who had died of malnutrition in the same region. That number in the last 12 months rose to 25, so almost double. Why have the previous interventions not been successful?
So what we have to unequivocally state is that there has been progress made. The provincial government has come to the table and they have developed a draft provincial food and nutrition security plan. There's a multi-sector task team that has been established. But what we are seeing on the ground, unfortunately, Tebekile, is that we are not seeing an impact and improvement in the lives of the children. In fact, the Human Rights Commission actually called for a state of disaster to be declared 2 years ago because we do not see this matter being addressed with the urgency that it deserves. Now, there's a lot of reasons for us to be able to unpack why the needle is not moving quickly and fast enough. But for now, the Human Rights Commission is looking at our mandate specifically, the fact that we have issued this report, and the fact that we are not seeing an improvement and an urgent improvement in the lives of children. And we are considering going back to the drawing board and holding those to account.
I wonder what that would entail and whether that help, that intervention would come soon enough to prevent further deaths, because when you look at the figures from the Health Department in the Eastern Cape, a further 237 children, again under the age of 5, have also been diagnosed with severe acute malnutrition. So what would the drawing board, or going back to the drawing board, entail for you right now, and can it happen fast enough to spare their lives?
So you're making a very, very important comment, is that the lives of children calls for absolute urgency. The Human Rights Commission, we've met with the legislature, we have met with the executive, we have called for an urgent intervention in this respect. Now, we will be engaging with both of these arms of government very, very urgently so, and we are considering subpoenaing not only provincial government, but also national government. Because as you would recall, we have indicated that the child support grant does not meet the food poverty line. Our children are going to bed hungry, and our children, as per your reports now and the Daily Mavericks reports, are dying of hunger. And if we do not adhere to what the Constitution already calls for us to do, you will recall that Section 28 has no internal limitation clause. We cannot say that budgets do not allow us to address the urgent needs of children. We do not have this. The Commission is urgently considering subpoenaing these government departments and then ultimately going to the court on an urgent basis.
And which government departments would those be, Doctor?
So we made a plethora of recommendations to a range of government stakeholders, but the most important would be the Department of Social Development. We are aware that Treasury has allocated a huge number and a huge sum to this department in order to address food insecurity. We would also be subpoenaing the Department of Agriculture to make sure that they have in their within their mandate also put in place urgent mechanisms to respond to the needs of families who are insecure in their food security. So there's a range of departments, and there's also specific the Office of the Premier, who has the mandate and the authority to declare a state of disaster if the need calls for that. Now, the Disaster Management Act, in our view, is very applicable in this respect, and that is what we are going to look at. Also, we've engaged with the National Treasury, we've engaged with Provincial Treasury And the answers seem to be the same every time we go back to the drawing board, that there's simply no money. But for us, we are to interpret what the Bill of Rights say, what international law calls upon the Commission and as well as government to do. And we will be making sure that we anchor ourselves in those.
One of the most alarming aspects of this, if I can phrase it in that way, is that the Nelson Mandela Bay Metro, where Gqeberha is, for example, is one in terms of a comparison with the other regions in the Eastern Cape where households, for instance, earn slightly more. And if children are dying of starvation, of lack of food in NMB, it makes you wonder what the rest of the picture is in other more poorer parts of the Eastern Cape.
Absolutely. This is a lived reality in most of the wards within the Eastern Cape. We are looking at a 33% unemployment rate nationally, and surely that is much higher within this province. What we also know is that there's been a very pertinent focus on only 39 wards within the province, whereas most of the wards deserve urgent intervention from not only provincial government, but from national government. Now, the reason the Commission has been very clear in its recommendation in terms of disaster management is that would unlock emergency funding from national government. And that is what we are saying needs to happen in this case. We are going to have a look at all of the stakeholders. We are going to engage with all of our close CSO partners as well, just to identify what are the triggers for this increase, especially in Nelson Mandela Bay area. But you are very correct to say that this is certainly not an isolated increase, and we are engaging the Department of Health as well for the updated provincial list of severe acute malnutrition deaths as well.
Dr. Eileen Carter from the Human Rights Commission in the Eastern Cape. Good to talk to you about a very devastating story in the Eastern Cape.